Hello and welcome to RB Medical Coding class. Today, we'll test your knowledge with some important compliance MCQ questions. Compliance is a key part of medical coding, and understanding it is essential for accuracy and ethical practice. Let's start. Question 1. What does HIPAA stand for? A. Health Insurance Privacy and Accountability Act. B. Health Information Protection and Authorization Act. C. Health Insurance Portability and Accountability Act. D. Healthcare Information Privacy and Assurance Act. Answer. C. Health Insurance Portability and Accountability Act. Question 2. Which of the following is an example of UP coding? A. Reporting a lower-level code for a complex procedure. B. Assigning a diagnosis code that is more severe than the actual condition. C. Using unspecified codes when a specific code is available. D. Using the same code for multiple visits. Answer. B. Assigning a diagnosis code that is more severe than the actual condition. Question 3. What is the purpose of the OIG, Office of Inspector General, in medical coding compliance? A. To create medical coding guidelines. B. To investigate and prevent healthcare fraud and abuse. C. To approve all medical claims. D. To determine physician reimbursement rates. Answer. B. To investigate and prevent healthcare fraud and abuse. Question 4. What is considered a violation of patient confidentiality under HIPAA? A. Sharing patient information with a physician treating the patient. B. Discussing patient details in a private office with authorized staff. C. Sending patient information via unsecured email. D. Using encrypted software to transmit patient records. Answer. C. Sending patient information via unsecured email. Question 5. Which of the following is an example of a compliance risk in medical coding? A. Assigning the most accurate diagnosis code. B. Coding strictly based on physician documentation. C. Reporting unlisted procedures without supporting documentation. D. Submitting claims only for services provided. Answer. C. Reporting unlisted procedures without supporting documentation. Question 6. What is the consequence of unbundling in medical coding? A. Faster claim processing. B. Lower reimbursement for services. C. Overcharging and potential fraud investigation. D. Increased patient satisfaction. Answer. C. Overcharging and potential fraud investigation. Question 7. Under HIPAA, which of the following is not considered protected health information? Phi. A. Patient's name and medical record number. B. Diagnosis and treatment details. C. Physician's name and office address. D. Patient's insurance information. Answer. C. Physician's name and office address. Question 8. What does the False Claims Act prevent? A. Submitting fraudulent claims for payment. B. Reporting undecoded procedures. C. Submitting denied claims for appeal. D. Using unspecified codes when necessary. Answer. A. Submitting fraudulent claims for payment. Question 9. A medical coder notices that a provider consistently bills higher level A and M codes without documentation to support them. What should the coder do? A. Ignore the issue and continue coding. B. Report the issue to the compliance officer or supervisor. C. Modify the codes without informing the provider. D. Submit the claims and wait for an audit. Answer. B. Report the issue to the compliance officer or supervisor. Question 10. What is the purpose of a National Correct Coding Initiative, NCCI, edit? A. To increase reimbursement rates. B. To prevent improper coding combinations. C. To identify duplicate claims. D. To allow for faster claim approvals. Answer. B. To prevent improper coding combinations. Question 11. Which of the following would not be considered fraudulent activity in medical coding? A. Upcoding procedures for higher reimbursement. B. Reporting services that were never performed. C. Using modifier 59 correctly to indicate a separate procedure. D. Billing for unnecessary procedures. Answer. C. Using modifier 59 correctly to indicate a separate procedure. Question 12. What should a medical coder do if they are unsure about a coding rule or compliance issue? A. Guess the best possible code based on prior experience. B. Ask the provider for clarification. C. Refer to official coding guidelines or consult the compliance officer. D. Submit the claim and wait for a denial? Answer. C. Refer to official coding guidelines or consult the compliance officer. Question 13. What law protects whistleblowers who report fraudulent medical claims? A. Anti-Kickback Statute. B. False Claims Act. C. Stark Law. D. Affordable Care Act. Answer. B. False Claims Act. Question 14. If a coder knowingly assigns incorrect codes to increase reimbursement, what type of fraud is this? A. Unbundling. B. Upcoding. C. Downcoding. D. Medical necessity fraud. Answer. B. Upcoding. Question 15. What is the purpose of a compliance program in a healthcare organization? A. To maximize insurance reimbursement. B. To ensure adherence to legal and ethical standards in coding and billing. C. To prevent payers from denying claims. D. To increase patient visits. Answer. B. To ensure adherence to legal and ethical standards in coding and billing. CPC exam preparation notes. Easily pass the exam. Looking to pass your CPC exam with confidence? Check out our comprehensive CPC exam preparation notes below. We've covered everything you need to know to succeed, from key topics to tips and tricks. Don't forget to review them and prepare well for your exam. Get your CPC exam preparation notes here. IMP Mock Papers. Anatomy, Terminology, Compliances, IMP MCQ questions, CPT All Series questions, ICD-CPT Guidelines, 2025 ICD-CPT New Updated Codes. Check out video description for more description. Prepare smarter, not harder. Start your journey to becoming a certified professional coder today. If you enjoyed this video, don't forget to like, share, and subscribe for more helpful tips and content to boost your CPC exam preparation. Also, make sure to check out the description box for additional resources and notes. Thanks for watching, and I'll see you in the next video.